Good afternoon and welcome to the Rural Rapport. My name is Sandra Renner and I'm the Farming Community Director here at the Center. And for those of you who are joining us for the first time or not as familiar with the Center, we are a national nonprofit organization based in Lyons, Nebraska. Since 1973, we've been a leading force engaging people to build a better rural future. And the Center does this through federal and state policy advocacy in Nebraska, Iowa, South Dakota, and Minnesota. And here in Nebraska, we also focus on small business development and training, business and home mortgage lending, as well as community development and capacity building through hands-on training, education, and leadership development in the areas of farm, food, and environment, Native community food sovereignty, and rural community inclusion. As long as rural advocates are needed for healthcare, clean energy, and sustainable ag and food systems, we'll be here. And today I'm joined by my colleague, Jordan Fireherm, Community Development Manager here at the Center, along with three special guests. From Nebraska Department of Health and Human Services, I have the CEO, Danette Smith, and Chief Medical Officer, Dr. Gary Anthone, along with Melanie Thompson, Emergency Response Coordinator at Elkhorn Logan Valley Public Health District here in Northeast Nebraska. I just want to mention this public health department covers the county where our home office resides, and we've worked closely with them to prioritize community and staff safety during the pandemic. So welcome, esteemed guests, and thank you for joining the Center to host an online town hall for rural people across the state to get the most up-to-date information and get their questions answered about COVID-19 and vaccination. I'd also like to share the format we'll follow today. We will have a short presentation from our guests, and then we'll be opening things up for questions. We want our rural voices, concerns, and questions to be heard. And so if you already know what those are, please add them to the chat and we'll work on getting those answered for you. I have colleagues watching the comments and I want to thank them in advance for helping me today. And some folks have already sent in their questions in advance. So whenever you're watching this, we'll try to get those answered too. Before handing it over to you all, I also want to mention that this online town hall is part of a larger series that Nebraska DHHS is partnering with local organizations on to bring factual information to different audiences we have across Nebraska. They've already partnered with several organizations in the state focused on African American, Native American, Latino, and refugee communities. And today we're focused on rural communities, and we're planning to do another online town hall together in Spanish next month for rural audiences as well. So as I hand it off to you, Danette and Dr. Anthone, maybe I'll just ask you this. What are you learning or hearing most from these town hall experiences? Oh, we cannot hear you. Looks like you're muted.
I believe your phone line is muted. I think that's why we can't hear you.
Can you hear me now?
Yes.
Oh, wow. Thank you so much. Thank you so much for your patience. The question you asked me was, what have we learned through all of the town hall meetings? Is that correct?
Yeah, what have you been learning and visiting with the different communities you've been talking with across the state?
Sure, a couple of things, and I'll also let Dr. Anthone respond based on his experiences. A couple of things that I feel that I've learned is how important access is to Nebraskans. Regardless to whether you're living in Omaha or Lincoln, or if you're out at the Panhandle or in some of the more rural communities, the ability to have access, that's almost, and I know we're not going to be able to achieve this in every instance, but almost access where you can walk out your front door and get the kind of medical care that you need. So that's the first thing that I've learned. The second thing that I've learned is how important it is to have good information that has been validated and that is culturally and linguistically appropriate so that people can read it in their native language, but it's good information that they can share not just with their families, but also with their community. And then the third thing that I've learned is how important community is here in Nebraska. I've worked in several very large states and very large municipalities, and the ability to make our information to be accessible and engaged from a state perspective, I have found to be very, very important to Nebraskans. So we've been out and about in the community, even though some of the town hall meetings have had to be virtual, we have tried to be almost reach out and touch with our information. And we've also tried to share good information that we think is pertinent for that particular community from the eastern part of the state all the way to the west. So those are some of the things that I've been learning and some of the things that I hope over the next year or so that we'll be putting in place so that we can better serve Nebraskans. Dr. Anthone?
I've lived in Omaha almost all my life, and this past, or 2 weeks ago, I was able to go out and visit central and western Nebraska, and really it's my first time out in the western Nebraska, even though I've lived in Nebraska all my life, and I was very, number one, it's beautiful. Number two, how much difference there is between western Nebraska and the east side of Nebraska, and I guess even though we're all one state, and like Danette said, we all feel like one sense of community, it brought to my attention, you know, how diverse we are here in Nebraska as far as our different topographies and different communities, things of that nature. So it was an eye-opener for me to get out to the central and western parts of the state and just to see things with my own eyes.
Wonderful. Well, thank you both for sharing some of your insights. I'll go ahead and you had a few slides you'd like to share, and I'll go ahead and key those up now.
Thank you.
Okay.
Sandra, if you don't mind, I'm going to go right into the very next slide, if that'd be okay.
Sure. Okay. Can you all see that? I might not be showing you the right thing here.
You were showing the right slide. It went away.
Okay.
It's
there you go.
Back. Coming back. All right. There we go. I'm hoping that your listeners are aware that we are in phase 2B, but actually it feels like we're beyond this because so many Nebraskans are getting vaccinated. As many of your listeners know, the Pfizer vaccination has allowed us to vaccinate persons from 12 years old and older, as well as we have the Moderna that's being used for 18 years old and older, and the Johnson & Johnson. We have done very well in this state to make sure that we're getting shots in the arms. And although you see those numbers that show that we rank 26th in the New York Times and 25th in the CDC in terms of getting persons here in Nebraska vaccinated, I can tell you we have been as high as the 10th state in the United States in the New York Times, and I know with the CDC's ranking of percentages of persons being vaccinated as high as 8th in the nation. So we're very proud of the strategies that we've put together to ensure that Nebraskans have access to getting the vaccination, but most importantly, that they have good information. I always like to share with Nebraskans that the vaccine is a proven tool, but not only is it a proven tool, it is an extra layer of protection against the virus. I know because I've been in Nebraska for 2 years, community is everything here. And you don't always see that in all of the states that I've worked in. But here, the community is important, And that extra layer of protection allows you to not only protect yourself, but protect your family and your community. And I know that that's important because we feel a sense of pride and protection of the people that we come in contact with. Next slide. We launched a campaign. We've had two campaigns here, but I would tell you the most popular one is finishstrong.ne.gov, and that Finish Strong campaign really heightens the importance of getting vaccinated across the state. We are urging Nebraskans when they can to register at our portal. It's the state's portal called vaccinate.ne.gov. I'm going to repeat that again, vaccinate.ne.gov. Now, we do know that some of our local public health departments have had their own portal where they are able to take calls or a Nebraskan can register to get vaccinated, but this is the state's portal. And what happens is that local public health department goes in and is able to pull those persons that reside in their health district to call them and to get them set up for vaccination. We also have a 800 number, and that number is 833-998-2275. Again, that number is 833-998-2275. And please feel free to use that number. We can answer questions about the vaccine, how to get registered, who is your local public health department, so that we can make sure that you get vaccinated as soon as possible. And as always, although we've seen just a slight decline in getting vaccinated, there are appointments that are available throughout the state. The next slide, please. As of this morning, we've had 392,000 Nebraskans who have registered for the vaccination, and we're really happy about that. And the average age of those registered is approximately 51 years of age. You can notice for those persons who have registered for the vaccine and using our portal, we have all of the public health departments listed down there, and you can see the frequency in which Nebraskans have used the portal to get registered for the vaccine. I know that Dr. Anthone will talk a little bit about age of some of the persons who have gotten vaccinated. So, for example, we are seeing in our population those persons 64 and above. We're at what percentage? About 80?
Or 80% of age 65 plus being fully vaccinated. It's one of the highest in the nation.
And so we're really proud about that statistic. And I think, you know, what I want your listeners to know, Sandra, is that we have done a full court press here, along with our local public health departments and FQHCs and health centers, to make sure that everybody has good information, understands the vaccination, what it means for them, and the importance. And because we've done that, certainly at the beginning of the vaccine, we had a high percentage of Nebraskans wanting to get vaccinated. Next slide. We have approximately a total of 914,000 Nebraskans who have gotten vaccinated, which we're really happy about. Our most recent statistic is 48% of Nebraskans' population is fully vaccinated. So we're very, very happy about that. I'm not going to read the totals down on this slide, but you can see from some of our rural communities where they are in terms of having persons that are fully vaccinated. Next slide, please. So how can DHHS help? Well, we want to keep open lines of communication, and what I mean by that is, as your listeners, Sandra, have questions about the vaccination, Dr. Anthone and I stand ready to answer those questions, have small town hall meetings, do some of that myth busting that we heard is not only in our western part of our state, but we've also done it on the eastern part. We want to make sure that we provide really good information about what the vaccine can mean to you and why it is so important. We're doing all that we can to make sure that everybody knows that in the state of Nebraska, we want to finish strong. And we would recommend that you go and you look at some of our commercials and educational materials that can be used throughout the rural communities to best explain what the vaccination would mean to your listeners. And again, we want to suggest that you go to finishstrong.ne.gov. And for those persons who still want to get registered, we want them to go to vaccinate.ne.gov. And again, Dr. Anthone and our team stand ready to answer any questions at town hall meetings that you think need to be answered. We love doing outreach. I've done a lot of outreach in the last 14 months, and so any opportunity to talk directly with the community, we welcome that opportunity. And so with that, I'm going to turn it over to Dr. Anthone for additional information.
Thanks, Danette. If we go the next slide, please, and the next slide. I'm just going to start off with a little bit of where we're at here in the state of Nebraska as far as how we're doing with hospitalizations and maybe a little bit about our number of cases. Then I'm going to talk about variants, and then I'm going to end by stating, because of these variants, excuse me, why it's so important, even more so now than at the beginning of all this, to go ahead and receive the vaccine. This shows how the state of Nebraska has fared as far as the number of patients that we've had in the hospital, in the ICU, and on ventilators from June of last year to June of this year. And you can see right around Thanksgiving time of last year is where we hit our peak of around 1,000 people statewide in the hospitals. And that's in the solid line. And you can see after Thanksgiving, beginning in late November, early December, how we had a steep decline in the number of people being hospitalized. And that had to do with basically the vaccines coming out. So we had 18 straight consecutive weeks of a decline in hospitalizations until around the end of March, early April of this year, where we started to see a rise in the number of patients in the hospital. And this was due to the variant strains that were starting to be sequenced here in the state. But over the last 7 weeks now, we've had a steady decline in the number of hospitalizations, such that as of yesterday, we only had 27 patients statewide in hospitals, which is the lowest number we have had in the hospital throughout the pandemic. If you can go to the next slide. This just shows how many people in Nebraska have gotten tested. In the orange line, we're right around 55% of the population of Nebraska getting tested at least once. And then in the purple line, if you'll see, that's our test positivity rate. You can see around Thanksgiving time where we were getting close to 20% of the people that were getting tested were testing positive. Over the last 5 weeks, we've been below 2% of the population getting testing positive. So that's a number that we're very, very happy with. You can go to the next slide. Just a little bit about how the vaccines work, so I can sort of explain how the variants, might not be susceptible to these vaccines. We have 2 mRNA vaccines, the Pfizer and the Moderna vaccine, and basically they're vaccines where the spike protein sequence of that RNA of the virus has been sequenced by scientists and then enveloped in a lipid coating and then made it to a vaccine. That mRNA is then transformed in our own cells once we're vaccinated to form these spike proteins. These spike proteins are then presented to our immune system, and our immune system makes antibodies to that spike protein. If you go to the next slide, the Johnson & Johnson vaccine uses a similar process, but rather than using an mRNA, they use DNA of the virus, and they put it in what's called an adenovirus, which can't be replicated, but it's the same process. It mimics the process of making these spike proteins, so our immune system will make antibodies to it. And then the next slide, please. So we were all doing fine when we had the wild type strain until around the end of the year and early January, when we started hearing about these variants popping up throughout the nation. Specifically, if you go to the next slide, the first variant first of all, what does that mean when you get a variant? Well, the variants are mutations that happen either on the RNA sequence of the virus, and then on the spike protein of the virus. So if you go to the next slide, when those spike proteins when they mutate, they can form a better fit to attach to our cells and therefore make the virus more transmissible and also more virulent, more pathogenic, lead to more deaths, lead to more hospitalizations. So by those mutations taking place, these viruses become more transmissible and more virulent. If you go to the next slide, this just shows what the spike protein looks like in a three-dimensional model, and you see the number 501 in the top right-hand corner. And that means that that's the part of the spike protein that was first mutated from the UK variant. But if you can see, it's just a small part of that spike protein that has a mutation on it. And that's why our antibodies now that we form when we get the vaccine are still good against these variants, because the variants, even though they're more transmissible and more virulent, the vaccines still work because they attach to the entire spike protein, not just that one little segment. So that's what a variant means, is that these little variations can lead to the virus being more contagious and maybe more virulent or cause more illness, but our vaccines now are still very, very effective against these variants. If you go to the next slide. So the first variant that was really recognized was from the United Kingdom. It's called the B117, or the UK strain. And they found in the UK that the patients that had this strain had more, basically transmission rates were up, about 150% more able to be transmitted. And then they found it also led to more hospitalizations and deaths. Right now in the state of Nebraska, we have sequenced about 1,624 of these UK strains. And it does remain the highest number of variants that we've sequenced here in Nebraska. But if you go to the next slide, but what we're really concerned about now, even though the UK strain is the most common one that's been sequenced in Nebraska, we're seeing the last one on the slide there, the B1617, the India or Delta variant, that's starting to take over even the UK variant. As a matter of fact, the number of sequence variants that were done this past week, the India variant has doubled in the number. And that's the one that we're concerned about right now, is the India variant or the Delta variant that you're hearing of. It is more contagious and it is more virulent, or causes more serious illness, which leads to more hospitalizations. If you go to the next slide. We go to the next slide. So far we've sequenced almost 1,909 variants, but again, as I mentioned, all three of the vaccines we have available here in the United States are effective against the B117, the India, and all the other variants that we've been able to identify. If you go to the next slide. So we're also worried about maybe the variants leading to having people that have been infected in the past getting reinfected. And we have seen about 236 possible reinfections here in the state of Nebraska, but so far we don't see a trend to what variant causes more reinfections. We have seen, however, about 708 vaccine breakthroughs, which mean people that are fully vaccinated may be getting infected again. We're confident in 280 of those being really true vaccine breakthroughs, and there is a trend we're seeing in those vaccine breakthroughs with the India variant. So we're very concerned about the India variant in people that are fully vaccinated of getting infected again. Well, how can we stop this from happening? If you could go to the next slide. We know that mutations are going to take place. We know that mutations can increase the transmissibility of the virus and even maybe lead to more hospitalizations, but we want to keep the variants from multiplying. And one way to keep the variants from multiplying is to get vaccinated. Now, if we can keep these variants where they're at now so they aren't able to replicate and maybe even lead to more variants, that's what our goal is now. So that's why we want to stress it's important maybe now, even more than at the beginning of all of this, to get vaccinated so these variants don't have a chance to take off and lead to more transmission or lead to more hospitalizations. A statistic I just heard today was that about 99% of all COVID deaths in the United States now are in people that have not received the vaccine. So, I mean, that is a very, very powerful number. And we can prevent that by just getting vaccinated. We know not everybody is able to get the vaccine, but the people that are able to, think of it not only for yourself, think of it as doing something for your community. So I'll end it there, Sandra, and turn it back to your team and questions. We'll be happy to answer any.
Thank you so much. Yes, Dr. Anthone and Ms. Smith, if you have questions, go ahead and place those in the chat, and we'll get to those in just a minute. For now, I would like to hand it over to Melanie at Elkhorn Valley Public Health District to share a little bit more data about our local area here in Northeast Nebraska.
Hey everybody, this is what we have right now. Forward here. So this shows our vaccination rates, and we are considered a rural area. Madison County is where our largest population base is, with Norfolk. One of the things that just came out here recently was an article by the Omaha World Herald about the gap between the rural and the urban areas. According to this article, Nebraska falls at the very bottom of this. We have the largest gap between rural and urban areas in vaccination rates, with a 20-point gap. So in other words, urban areas are roughly about 60% fully vaccinated, and our rural areas in Nebraska are about 40% fully vaccinated. And you can see that for the most part, that's kind of the case here, with the outlier being Stanton County for our rural areas. I think one of the things, there is a campaign in Western Nebraska that says, you know, you'll get your cattle vaccinated. Why wouldn't you get your humans vaccinated too? And I think that that's a really important thing. You know, we know how diseases spread, and we can put that tool of vaccination in there to help stop that. One of my favorite things to do, which is kind of odd, but I like to walk through older areas of cemeteries. And if you go back into the late 1800s, you'll see that there were a lot of children and young people who died. Sometimes they'll say what they died from, and often they're from vaccine preventable illnesses, and they didn't have the advancement of vaccines at that time. Right now, you know, if you have a 14-year-old die from an infectious disease, it's a travesty, because we have healthcare that can handle it. We have vaccines that can prevent it. We live in a great time that we are able to handle these kind of pandemics. And I think as the state of Nebraska, we're very proud of our state. And I think that it falls on all of us to make sure that we are vaccinating whenever possible to, you know, prevent this horrible thing from continuing. I recently went on a vacation in Western Nebraska, and I did not have to wear a mask. That was so wonderful to finally have that bit of freedom to be able to do that. And I want to continue that. I don't want the variants affecting that, but you know, there is the chance that that could happen. We pulled this information from the state so that we would know what kind of variants we had in our district. So far, we're just showing that B117, which, you know, we're seeing all across Nebraska. The India variant down there that they call the Delta, that has started showing up in Nebraska, and it has shown up in a neighboring health district, which is a rural area. Anytime that you're not vaccinated, you really open the door to catching this and then spreading it to your neighbors, to people that might be more vulnerable to COVID. We do not want to overwhelm our healthcare system the way that we did early on in this pandemic. You know, that is always what we're going for. But we also, you know, we have these people who have long COVID, who are going to have the repercussions of having contracted COVID probably for the rest of their lives. You know, this is still new. I mean, maybe we'll figure out how to deal with it. But, you know, we're also trying to prevent future diseases as well. When we first started doing the vaccinations here in the health district, we had a huge push to go out to every single town. Our goal was to take a mobile clinic at least one time to every town in our health district so that people would not have to drive to get their vaccines. Now that we're more into a more permanent kind of situation, we do have locations that have a regular schedule that people can come in Norfolk and West Point and Tacoma. So one in each of those counties. As someone, I live on a farm myself, and it's no big deal for me to drive 30 miles to Norfolk on a random Tuesday because I'm out of sour cream. So, those of us in the rural areas, we're used to driving. Our health department has tried to make it so that, when you're doing your runs to the larger towns to get your groceries or whatever, hey, I could swing into the mall. I could go on, down to West Point or Tacoma. I could get my shot while I'm getting my groceries. And so we've tried to accommodate schedules, without having to put all the effort out of going to every single little town. But overall, that's the picture that we have up here in our health district.
If I could add just one thing, Melanie, that was great. And your numbers there for the India variant showed 16 at that time. I just had the new numbers today, and it's 62. So the India variant is doubling and tripling every week now. So that's the one that's going to be the most important one to follow in the future. It's overtaking the UK variant now. So that was good that you showed that.
Well, and I think one of the things that people can do, Dr. Anthone, you've really done a good job of sharing with us what the numbers in the hospitals are over this whole pandemic. You've always been really good about making sure that the health departments and the public know, what's happening in our districts. And I do think that is important for people to realize that as we start to see those variants crawl up, especially that Delta variant, we're going to start seeing those numbers go up again in the hospitals. And speaking for myself and probably for all of the Nebraskans, we really do not want to have to wear masks again. We don't want to have to close down businesses. We don't want to do those things. We want to open our schools. We want to have concerts. We want to have games. We want to do those things. But to do those things, we have to look at vaccination. So we have to consider all of these things and keep an eye on the numbers.
And Melanie, that's why it's a community issue. You are exactly correct. It's more than just me being vaccinated, but my vaccination impacts everybody that I come in contact with. And so in order for us to manage that variance, that Delta variance out there, we've got to take all the safety precautions that we possibly can. I still share with people, it's not popular and we really don't want to do it, but if we feel like we're in really large gatherings where we don't feel comfortable, certainly you can put on your mask, but you don't have to. But a couple of things you can do is you can continue to wash your hands where you can, 6 feet apart. Those things still work. And as much as we can, we all like large gatherings. I know I do. But wherever we can minimize some of those large gatherings, we want to do it. You don't have to do it, but these are all the necessary non-pharmaceutical interventions that we can still continue to use as we manage the variances that Melanie and Dr. Anthone have talked about. So I just want to remind people that those are things that we can do. But most importantly, getting vaccinated is number one.
Just again to tag on what you said, Melanie, you really reminded me to say this too, is that of the people that have been fully vaccinated that have been reinfected with the Delta variant, not one has needed a hospitalization. All the hospitalizations in people that have the Delta variant have been in people that are not vaccinated. So that's another important number to know, that even just not going to the hospital is also prevented by getting the vaccine, not just deaths, but needing to go to the hospital. And of course, needing to go to the hospital means you're fairly ill. So you want to prevent that from happening.
And I think one of the things that we don't talk about, maybe not enough, right now, this vaccine is free. to everyone. If you end up in the hospital, you've got thousands and thousands of dollars that you're going to have to figure out how to pay, whether for insurance, you've got your deductible, you will miss work, so there is a monetary cost associated with this. So I do think that that's something that people have to consider.
Good point. It's a great point.
Good point.
Well, and I definitely appreciate it coming full circle. What at the top of this, Danette, you mentioned that we all recognize how important community is to Nebraskans, and how this is a community responsibility, and how this does affect others in our community. When we're vaccinated, or when we choose to wear a mask or social distance. So they really go hand in hand. I think we're at a point where we're ready to start taking some questions. I have Jordan and Teresa on standby watching the chat. And Jordan, do you have a couple questions you'd like to share with us now?
I do, and thank you very much for taking the time to answer some of these questions. We've been getting quite a few, but you've done a great job and have answered quite a few as well. So I'm going to start with a couple of the big umbrella questions that encompass a lot of the different concerns that we've been hearing. So I guess to start off with, is there anyone that should not get the vaccine at this time?
As far as not getting the vaccine, we know it's a personal choice, and there'll probably be some where your patients, where the provider would say, maybe hold off on getting the vaccine for some reason or another. But that would be a decision that would be hopefully made with your primary care provider or someone you trust in the medical field. I know I had a daughter who was pregnant during the COVID, and she got vaccinated, so that's not a contraindication. Some people said if you're really immunocompromised, maybe you should consider holding off for a while until maybe your white blood cell count or immune system comes up a little bit better. But as of now, it's mostly a personal decision where people would hold off on getting the vaccine. I mean, I just had a family reunion that I went to this past weekend where for some of my own not immediate, but cousins and other family members were holding off on getting the vaccine because they heard some things like Danette said earlier, they're sort of myths about not getting vaccinated. And we need to try to dispel those myths as best we can. And probably the best person to trust is your primary care provider to get his or her opinion to see whether you should get vaccinated or not. So that'd be my best answer to that question, Jordan.
Thank you very much. I think that's a very good point. Trust your primary care physician and get the information from them. Concerning folks, what about folks with severe food allergies? Is there any concern that we've seen for folks with severe food allergies?
I have not heard any association with the vaccines with food allergies. So no association that I know of. Melanie, have you heard of any?
No, I also have not heard of anything yet. And we have also not seen anything either.
The one thing that happened maybe, it was a couple months ago when there was some blood clotting issues associated with the low platelet count with the J&J vaccine. And even though it was like less than a 1 in a million chance that would happen, it did show, and it showed that our system works, that the adverse reactions that are being reported to the national system was how that was picked up. So if people are worried about maybe something happening, there's been over 300 million doses of vaccine given now in the United States alone. And you think, we had like 15 cases of that blood clotting, and we were able to pick up on that. So you think of something like food allergies or something like you were saying, Jordan, was going to be associated with the vaccine. You'd think we'd know by now. So, that to us proved how well the system works, as well as even these very, very, very low chance of these blood clottings got picked up and detected.
Thank you for answering that. And I have another question here that it's kind of two questions that we often get hand in hand. And the first part of this question is a lot of people feel that the vaccine was developed really quickly. Is there any concerns of long-term safety with the vaccine that was seemingly developed quite quickly? And to build on that, could you also speak to, I know mRNA isn't a term that's familiar to a lot of people. So could you talk a little bit about the mRNA vaccine, as well as the speed at which the vaccine was developed?
So I was privileged enough as the state health official for Nebraska to go to the White House summit back in early December to just brief us as state health officials on how to answer that question, because they knew at that time in early December when the vaccines were coming out that there was going to be some questions about how did this happen so quick? It happened so quick, it's not going to be safe or effective, and how do we trust it? So what they told us was that, first of all, this mRNA vaccine technology, they call it a platform, has been around for a while. It hasn't been used for a lot of different vaccines that we get, but that technology was around. So they had that technology to do that. And the science behind this is amazing. And so what they did, why it happened so quickly, was not because the trials were sped up. They had different trials. They went through 3 different phases of the trials to prove the safety and effectiveness. But while these trials were ongoing, even without knowing whether the vaccine was going to be safe and effective, they were making the vaccine. And they did this for almost every one of the vaccines that were being developed, is that the government and the manufacturers took a chance to say, we're hoping this is safe and effective so that when it's proven that it is by these trials, we'll get it out right away. And that's exactly what happened. As soon as the FDA approved the vaccine for an emergency use, it was delivered the next day. So that was one of the ways they tried to help us explain why it was done so quickly. It's usually going to take 2 to 3 to 4 years to do that, because no manufacturer wants to take that risk. But the resources, the money went into doing it that way. And that's how it was done so quickly. And what was the second part for that question, Jordan?
If you could just speak a little bit about mRNA. I know that's a term that not a lot of people are super familiar with.
So everybody's heard of DNA. Our cells are all controlled by our DNA, which make up our chromosomes in our cells. So DNA usually gets converted to RNA, and then the RNA is then transcribed and translated into a protein. Well, some viruses, rather than DNA, have just said, we're just going to be RNA. So like the coronavirus, the COVID virus, is an RNA strand rather than a DNA strand. And so I can't answer you why evolution was that way, why it went to an RNA strand. When you can think about it, it decreases a step in the process of the virus replicating. Because usually what would happen, the DNA would have to get converted into RNA, and then the virus would replicate. So now just having an RNA strand rather than a DNA strand, it sort of cuts down one of those steps. But that is, coronavirus is an RNA virus, and there are other RNA viruses. And that's, when you think of the technology behind how the vaccine was developed, they were able to find that one spot on that RNA strand that translated into that spike protein, and that's what the vaccine is. It's just that one little part of that strand of that virus. So you're not getting the virus, you're just getting that little sequence of that virus that translates into that spike protein. So people say, well, I'm going to get sick because I'm getting the virus. That's not the case. You're just getting a little snippet of that to make that spike protein. So unbelievable technology on how this was all developed.
That's really incredible. Thank you for sharing that information. And you, like I said, you've covered a lot of the common questions we get already. But here's another big umbrella question. We've heard a lot of talk about herd immunity, but here's a question that really gets to the point. How many people need to get vaccinated before COVID goes away?
Well, the governor was asked that question yesterday at his press conference, and that is something that, nobody really knows. I mean, if you remember at the beginning, Dr. Fauci said maybe 60% of the population needs to have immunity, and then that went up to 70%. and then that went up to 80%, so it seemed like they kept raising the bar. Right now, when you looked at the data that Danette showed and Melanie showed, the state of Nebraska is right about 50% of our total population being fully vaccinated. That is incredible. I mean, we did here in the state of Nebraska, what was it, Melanie? 4 years of vaccine administration in 6 months. What a tribute to the public health departments, the pharmacies, and everybody getting that work done. It was an unbelievable task. I mean, almost, some people say the whole issue with developing the vaccine and getting it administered might be as similar to our moon landing as far as how that was all logistically enrolled in things. But we have 50% of our population vaccinated. And now we know that there's some people that had the infection and maybe even knew about it. I mean, when I get the Red Cross data from the Red Cross, from people that go and donate blood for the state of Nebraska, they'll ask them, have you ever had COVID? And they'll say no. Have you been vaccinated? They'll say no. Do you think you've ever had COVID? They'll say no. And 50%, 55% actually, the latest one, show that even in those healthy blood donors, they have antibodies for COVID. So there's other segments of the population that probably have that immunity that don't know about it. And that's probably why you see in that graph I showed for the hospitalizations go down, that in combination with the people being vaccinated are why we're at the sort of like the steady state that we're showing right now. Now that doesn't mean that if you aren't, or if you had the infection, that you shouldn't get vaccinated, because most of the studies are showing that getting that vaccine gives you even better immunity than having the infection in the first place. So we would still recommend. Melanie, you can correct me if you're hearing any differently, but that's the latest data is still, even if you think you've had the infection, get the vaccine.
So I can actually attest to that. The first part of December, I did have COVID. I got my first shot of Moderna the middle of January, and I'm grateful that I got it. I do know that the vaccines work because my response to that, my immune system really kicked into gear after that first shot. It told me that, yes, you did have COVID and we don't want to do this again. So I can tell you that the shots do work. And I am grateful to have had, that opportunity to make sure that my immune system is going to recognize it again, and it's going to zap it out if it does see it again.
I didn't have an infection, but after my second shot of Moderna, I had the same sort of symptoms that you probably had, the malaise and almost like having a minor flu type symptoms. I sort of looked at it like a love-hate relationship, though. I didn't really like having it, but I loved knowing that my immune system was working to make those antibodies.
Thank you for touching on that. That was actually going to be my next question is, if I've already been infected, do I still need to get vaccinated? And it sounds like the answer is a resounding yes.
It is.
Well, thank you for that. That covers most of my questions, I think. Like I said, throughout your presentation, you did a great job kind of picking up the common ones that people have. Sandra, are there any other questions? Or Melanie, are there any other questions that you think folks might need an answer to?
I have one more comment that, your tax dollars, when we talk about, what this is costing, when we were doing contact tracing at our local health department, we were drowning in November and December with the number of cases that we were having and the amount of hours that we were putting in just at the local level, not at the state level, not everything else. I mean, it was Herculean, the amount of time and energy that we were putting into this. Your tax dollars were going to that. Now that we're doing vaccinations, it is taking a lot less time, a lot less money. It is a really good use of our tax dollars to put this into vaccinations rather than responding to the disease itself. And this is a good use of your tax dollars.
That is such a great point, Melanie, and I'll just tag on to that, and that is and this is the true facts, if you had a way to prevent yourself going to the hospitalization by 99% or by dying by 99.9%, that would be, to me, the real reason why to get vaccinated. I mean, what other medical, any sort of treatment can give numbers like that? So they're incredible numbers, and so far, hopefully we can keep these variants under control.
And just to jump in, I actually had a couple new questions just come through. So the first question is, speaking about an organization that already has a high level of vaccination, say 90% vaccinated, what more can an organization do to encourage their employees to get vaccinated, especially if it seems like there is just a small number of people who may be hesitant to receive the vaccine?
Well, it's funny because Danette and I had a meeting this morning just to answer that question for an organization, and one of the things I think is that you can provide some incentives. I think maybe, and that probably might be where we might go with this organization, is to provide some incentives. And in order to do that, though, the people that probably aren't vaccinated now need to be somehow reassured that the reason they're maybe not getting vaccinated, if it is a myth, that we bust that myth. And for this particular organization, we might also have some experts go out in the field or maybe do Zoom calls to try to bust those myths of those people that have not been vaccinated, along with an incentive. Now, we don't want to just incentivize the people really that haven't gotten vaccinated, because the people that have gotten vaccinated need to be given, an incentive too. So we're working on that now, on how we can make it fair for everybody that has received the vaccine or will get the vaccine.
I know when I've had an opportunity to talk with people who are hesitant, I start with, what's the fear? What is it that you're frightened of that will happen, or that you've learned something about? For African Americans, it's been a lot around testing and vaccines that were supposedly used to help. And so there's a great fear about that. Well, we know now that, yes, some of those things happen, but medicine has come a long way. And those kinds of things that were done 30, 40, 50 years ago just aren't done now. And we really have to look at it in terms of dispelling the fear, getting good information, and talking about what it means for you. So, for example, in my case, African American woman, middle-aged, I have comorbidities. It is not good for me to not be vaccinated. It will be a life-threatening issue for me if I should get sick again. And so I'm not willing to take that chance. Many African Americans have comorbidities. It's not in our best interest to not be vaccinated. And so I try to make the conversation as personal as I can with that particular person, and really talking about what's the fear inside of not getting vaccinated. What do you think will happen, so that I can start with dispelling that myth? Because some of the things that we're frightened about just simply aren't true, and we want to help the public better understand.
I think one of the things too that working in public health, working with other government personnel, with healthcare personnel, there is not one single person that I have met at the local, state, federal level who wake up in the morning and say, hey, I want to go out there and hurt some people. No, every single person who is in these government jobs or who are working in healthcare, they are here to help people. We would not be in these positions if we wanted to harm anyone. I believe in the science. I believe what they're telling me about the vaccines, because I have talked to them, to the people that I work with, and I know that there's not a single person out there who wants to harm another human being with what we're doing.
Thank you for sharing those experiences. Sandra, do you have a question?
Yeah, I guess I'd just like to ask, are there considerations ahead of this July 4th holiday that people should be considering, whether they're vaccinated or not vaccinated? And would you have any recommendations or just thoughts to consider ahead of July 4th gatherings?
Boy, I think my first one, as a local health department, if you are sick, if you have any symptoms whatsoever, please do not go around anybody else. I do not want to have to call you and do contact tracing with you. We are so over COVID, but the only way we can be over it is if you don't go out when you're sick. Dr. Anthone, you were going to say something?
Just, since most of the activities hopefully will be outdoors, that will help control things a lot better. But I agree with you, Melanie, that if you have any symptoms whatsoever, please, try not to be exposing anyone else and get tested.
Great, thank you. Jordan, did you have another question? I think we have time for one more.
Perfect, I have one more question. And the last question, so speaking for an organization like the Center for Rural Affairs, we do a lot of work that's community focused and networking with people in the communities, oftentimes in rural areas. And like we were talking about before, there is a divide between urban and rural in terms of vaccinations. So with counties that are below the 40% threshold that we were talking about, what marker should we use in determining when we should resume activities and events in communities and areas that do have low rates of vaccination?
I'd give the same answer Melanie just gave, that if you are having any symptoms whatsoever, that you try not to expose anybody. That would be my first advice. And then I think the one way we're going to get to that rural area higher vaccination rate is to do what I saw when I visited out in the Panhandle last 2 weeks ago. That is, we're going to take the vaccine to the people now, or the vaccine is going to go to the primary care providers. And that's hopefully going to get it up to those numbers that we need to get up to.
And I think the final comment is that ask questions of your primary healthcare provider. Ask questions as it relates to you, because your primary health provider knows your well-being, your physical health, and they can help gauge when it's right for you to take that vaccination. So we want you to ask more questions, be more informed so that you make a good decision.
That's helpful to know. Thank you very much.
I think we worked through all of the questions that have come in so far. If there's more that arise in the comments, we'll try to get answers for those as well. Dr. Anthone, Danette, Melanie, I just want to thank you all. This is obviously, we're not, at the peak right now, but it's still a very busy time. And I know that it is precious. And we really appreciate you joining us today to have this conversation and share more with rural audiences as we continue to navigate this next phase of COVID-19.
Thank you for having us.
Thank you.
Yeah, thank you.
Well, that's all for this week's Rural Rapport. As I mentioned, we will have another discussion like this in Spanish next month, so stay tuned for that. And thank you all for joining us today. For those joining us virtually, and to our panelists and guests, have a wonderful day. We'll see you next time.